which of the following is the most likely diagnosis in this patient? This is a 15-year-old boy. He is having malaise, dyspnea, jaundice, scleral icterus, and he's tachycardic, tachypneic, and the oxygen saturation is less than 90%. Lab will show anemia with reticulocytosis. Okay. Now this patient has reticulocytosis, which means his bone marrow is functioning completely fine. So I'll confidently rule out my aplastic anemia. The patient is not having any history of weight loss or infections or gum bleeding of any sorts or hepatosplenomegaly per se. This patient is presenting for the first episode of an acute condition. So I'll confidently rule out my acute leukemia. Then again, because this is an acute condition, I also rule out anemia of chronic disease. Right, anemia of chronic disease will have the symptoms of the chronic disease as well. It will not present with such an acute rise in malaise or your scleral icterus. It just present with subtle signs of anemia, that is your fatigue or inability to perform day-to-day functions, and that is what you'll see. So yes, sideropenic anemia will not again present with hemolytic symptoms. Here, because the patient is having jaundice and scleral icterus, it means there has been a hemolytic episode which has led to the release of your indirect bilirubin. So I guess this is enough clues to hint towards a hemolytic anemia. There is a 15-year-old boy, so he could be suffering from some hemolytic crisis if he was having an underlying red cell disorder such as sickle cells or sort, or he could have had a viral infection, or he could have taken a drug which triggers hemolysis. And because there is hemolysis going on, the red blood cells are very less. The bone marrow is working extra hard and creating more reticulocytes. And similarly, because the red cells are being destroyed, the oxygen saturation has fallen down to 90%.
Thanks for watching. Please give a thumbs up and subscribe for more.